Our wide variety of mattresses include orthopedic, pillow top, spring mattresses suitable for institutions like hotels and many others for home comfort. With every piece telling a story of royal excellence, our products are built with the highest quality materials made to last. Experience royalty with Royal Foam Furniture, proudly made in Uganda, so buy Uganda and build Uganda. Visit our showrooms at Ginger Road, Chambogo Junction, Bukoto Chisasi Road, and on Victoria Mall, Entebbe, on the first floor.
There was a time when health centers were dismissed and underestimated. But today, the story has changed dramatically.
I'm Dr. Naizuri Keti. I'm a pediatrician by training. By appointment, I'm a senior medical officer, and I'm the in charge of Namatala HC IV.
Our lens zoomed in to uncover the remarkable story of Namatala HC IV. At the center of this transformation is Dr. Naizuri Keti, whose commitment to maternal care is nothing short of heroic. She fights relentlessly to ensure that no mother dies in the theater due to preventable causes. Her passion is fueled by unwavering government support, a partnership she credits for the success she proudly shares today.
I preamble about Namatala HC IV. It started in 2002 as a health center 2, and in 2022 it was elevated to a health center 4. This was because of the growing population, but also to cater for the needs of the community. On that elevation, government has played a very key role in recruiting human resource to make sure they catch up with the growing population, but also they have improved our infrastructures.
With government upgrades and support, some of these facilities now outperform even the larger referral hospitals in certain areas. In Mbale, one name is on everyone's lips: Namatala Health Center 4.
Namatala serves a population of 42,000, not only for Namatala community, but we do have patients who come from other periphery districts like Bududa, Budaka, Butebo, Bukedea, the neighboring districts. Being that we are near regional referral hospital, we have attracted very many clients from those districts. So as I talk, initially we had, in the issues of maternal child health, we had approximately 20 deliveries. That is below 2006, 20 to around 30 deliveries per month. But as we are talking per now, we have around 300 deliveries per month, with approximately average of 45 cesarean section in this very place. So this has been due to the good service offered. Government declared to offer free services to its community and members. As a facility and the leadership of Namatala, we are making sure that the services are free of charge to the needy population and the slum area, and really they are free of charge. The customer care of the staffs who are employed with a very positive attitude towards patients is making the place grow very fast. Yeah, there's a growing number of patients who are coming for service.
But what makes this government health facility, tucked deep within the heart of Namatala village, so exceptional?
There are very many services we offer in this place. We offer outpatient services, we offer inpatient maternal child services, we offer operations, and of recent we had a lot of support from government, because before that we didn't have basic equipment to run the theater, to run maternal child health services, but government brought us, through Ministry of Health, we were able to get many equipments. As I talk right now, our theater is very well equipped. We have blood transfusion services. We do have a NICU, a neonatal unit, which has been set up for us. And we do offer other services, inpatient, pediatric, adult, male and female admissions. And also we offer the lab services. Actually, our lab initially would do basics, but as I talk right now, more machines have come in. We're able to do C-reactive proteins. We are able to do a CBC, and they are doing grouping, cross-matching. They are able to do TB screening. And as I talk in this community, I think we had an outreach where they identified 12 cases of TB just in the community. We are doing those active surveillance, and we are having integrated outreach as well. We identify those people, then we go out and look for more intensive finding. So looking at the current state, we have been well facilitated, and services are moving on well. When we come on issues of funding, government, initially, the PHC was little, but over time they have been revising and they are improving the primary health care, the non-wage, to the facility, so that these activities of the facility are able to run, so that power is there, water is there, integrated outreaches are running on, community services are running on, because the target is to minimize curative but improve more of preventive and promotive services in the community. Then we come on the issues of medicines and supplies. Also the budget of medicines and supply improved, because initially we were at around 22 million, but as I talk right now it has been growing each year, and as I talk right now our budget is around 33 million per cycle. A cycle, we mean 2 months. After every 2 months they supply those medicines, essential medicine, the vital medicine, and other commodities, so that they are easily available within our setting.
She takes us on a journey of comparison, showing the stark contrast between today's medical landscape and what existed under previous governments.
Before I grew up, we knew there were no drugs, there were few health workers, and even by then the training, they would have basic people injecting, nursing assistants, treat, and indeed I should say that parents could inject their children in their homes. And I've grown up seeing some people who are lame because of injection complications from unqualified people, either from home. Find someone has grown up but lame, but they injected into a nerve, and they didn't know, they were not well trained, or they were not trained to treat patients. Also drugs. Those olden days, people would use, I think, herbs, because they were unable to access the modern medicines, and also maybe because of unavailability. So people would resort to steaming, to herbs, and to all that. Also, what I note, I believe people used to die a lot in the bush, because mothers used to deliver at home. Here someone delivered and died when delivering. And they would deliver, and there would be no reporting anyway, they would bury. But as I talk right now, we are accountable to whatever goes on as technical people. A mother who dies in labor is a concern for everyone, to a child, to the government, to what. We are accountable, and we are very vigilant enough to make sure that no mother dies in what? In labor over preventable what? Causes of death. Avenues have been provided up to the level of the ministry. Actually, it has been set up the level of the ministry that they can monitor even at the community level what is going on, to make sure that a mother, a child, or someone does not die over a preventable what? Causes of death. Before that, though, immunization, people had a very bad attitude about immunization, but over time, people were getting complications of heart disease because of measles. They were getting pneumonias and getting heart disease, and you'd find most of the wards would be full of rheumatic heart disease and other diseases. But because of the innovation, and because government has been very vigilant, they have been able to immunize most of those diseases, which were killing people, but they are what? Preventable. So people are getting preventive treatment to prevent diseases which would cause long-term what? Complication. Currently, mothers are delivering in facilities, preventing maternal death due to institutionalized deliveries, where you find someone delivers at home or in the hands of an unqualified person or a TBA. Currently, people are utilizing, they are well educated, they are well sensitized, they are coming for government services. People, when children fall sick or when someone falls sick, they are able to come for medical attention in a government facility. And also what I should note that at least patients, with the interactions we have had, they trust government having qualified people than private setting. So you find patients prefer coming to government facilities for consultation than going to a private. So at least there are qualified people there. So people have trusted the service because of government commitment to service delivery. But not only that, government has trained its health workers through CMEs, that is at a local level, but also they're encouraging people to go back and upgrade, where they are able to come back with more knowledge to serve its population at different level. But also the referral system is very clear. Before that, people were being referred by motorcycles, they could have foot or different ways carrying. But as I talk right now, government has set up a system of what they call an EMA center, emergency center, at each region, where they are meant to activate that center to pick a mother who is bleeding, to pick a baby who is not doing well, a well-equipped ambulance, at least to able to be to transport a mother from one destination to another, from a lower facility to another, from the community to, so long as it's activated. At least we have a well-organized ambulance referral system plus ambulance system plus procedures of referral and care, not only being referred but with a staff inside an ambulance. So over time there have been an improvement in service delivery year after year.
You are watching the Lens program. Stay tuned.
Step into a world of excellence, comfort and pride with Royal Foam Furniture, crafted to perfection right here in Uganda. We bring you state-of-the-art living room furniture and bedding products at affordable prices. Our wide variety of mattresses include orthopedic, pillow top, spring mattresses suitable for institutions like hotels, and many others for home comfort. With every piece telling a story of royal excellence, our products are built with the highest quality materials made to last. Experience royalty with Royal Foam Furniture, proudly made in Uganda, so buy Uganda and build Uganda. Visit our showrooms at Ginger Road, Chambogo Junction, Bukota Chisasi Road, and on Victoria Mall, Entebbe, on the first floor.
Welcome back from the break. This is the Lens program.
I'm Dr. Masai Daniel Walter, a medical officer at Namatala HC IV. I happened to graduate in 2022, May, with a Bachelor's of Medicine and Bachelor of Surgery from Kabale University.
Traveling hundreds of miles back to his homeland, his mission was clear: serve humanity. He calls on the government of Uganda to accelerate the recruitment process for health professionals. This, he believes, would inspire more youth like himself to join and strengthen our health systems.
I really appreciate the government for giving us the opportunity to serve fellow Ugandans. Us, the young people, are overzealous and we are willing to serve. You know, sometimes you feel there's a lot you want to offer to the community. You want to return to the community. The government has provided you that good education, has provided you those facilities. So you really want to return back to the community by providing a lot of zeal. This whole community we serve is, we say, a low socioeconomic status, people who are, so we help and serve these people, provide them with free services that the government of Uganda has provided. So I really appreciate the government for this.
Studying is one thing, but studying and returning to serve your own community, that is a noble calling.
I wish that more and more young people like me are brought on board given employment, and they also I'm willing to serve. I know there are a lot of my friends. Recently, you heard of the recent, there was an advert for medical officers, and around 1,400 medical officers applied for 16 positions. So I hope the government can work on this, maybe put the doctors to the health center 3 so that we reduce these forms of unemployment. There are a lot of young doctors who are very intelligent, overzealous, willing to serve. So we hope that the government fastens the process and fills these human resource gaps so that we can help the young generation.
There is something powerful running through the veins of this new generation, something perhaps overlooked by many health institutions.
It is a very beautiful opportunity for me to work as a midwife, to give back to the community. And you see, when you see your own coming and then receiving service that is quality and good, and they feel like they should keep coming back again, bringing even more. It is really a wonderful thing, and I thank government, I thank my fellow workers for making the place, the environment so conducive for work.
Through our lens, it is clear that this untapped spirit could be the secret ingredient behind Namatala Health Center's phenomenal growth.
Let's continue supporting our government, and let's continue supporting our government facilities. Don't listen to whatever talk in the communities that government facilities have no drugs. We have drugs in place. Patients are not buying any supplies. Everything is there. So let's continue supporting our government.
Among the shining stars at the facility is a young and determined midwife, Esther Alamai.
Personally, I was born under the NRM. I've gone to study through NRM, and I'm also working under the same government. So as a young midwife, I would encourage all the youth out there not to be led by any other people talking ill about the government.
Having witnessed the progress brought about under the NRM government, she shares a heartfelt message through our lens, a call to fellow youth.
As young as you see me, I would love to encourage all the youth out there, continue studying. Don't be putting things of politics during school time. You move out of school. Just continue studying, focusing for a brighter future, because the government is ready to help us go through after school.
Life, she reminds them, is not always a straight path. Instead, she encourages them to think creatively and act beyond limitations, to work outside the box.
If you fail in getting a job you studied for, still you're comprehending in other things that will continue making you good citizens, and you'll be able to employ yourself with other skills like plumbing, hairdressing, catering.
Though midwifery is often feared for its complexity, Barbara and her fellow young Ugandan women boldly chose this path. They were driven by a deep desire to serve humanity, and the joy they find in saving lives is immeasurable.
I'm known by names Sarah Barbara, Assistant Inventory Management Officer, Namatala HC IV, Mbale City, Industrial Division.
Sarah Barbara commends the government of Uganda and calls on all Ugandans to stop spending fortunes on medical care elsewhere when quality medicine is available free of charge in public facilities.
When we opened the theatre, the population was too high because of the customer care of Namatala. So whoever is sent to main hospital, sometimes they come to Namatala, and the consumption is now very high because of the high population of Namatala. Everybody runs to Namatala because of customer care, and we are now not doing bad as those years when the budget was low. So we thank the government of Uganda.
These medicines belong to the people. She reminds us, no Ugandan therefore should die from lack of treatment.
All this medicine, come for it. It is for you Ugandans. It's a government which provided. It's not for private. Nobody has bought them apart from the government itself has bought for them. You come and receive this service freely.
Namatala Health Center 4 serves over 42,000 people, not just in Mbale, but reaching as far as Soroti, Busia, and Tororo districts. Thanks to sustained government support and a passionate, patriotic young workforce, this once overlooked health center is now being hailed as the future Johns Hopkins of Eastern Uganda. And as you will agree with our lens, at Namatala, impossible does not exist.
The Lens program was proudly brought to you by Atlas Industries Uganda Limited.
Step into a world of excellence, comfort and pride with Royal Foam Furniture, crafted to perfection right here in Uganda. We bring you state-of-the-art living room furniture and bedding products at affordable prices. Our wide variety of mattresses include orthopedic, pillow top, spring mattresses suitable for institutions like hotels, and many others for home comfort. With every piece telling a story of royal excellence, our products are built with the highest quality materials made to last. Experience royalty with Royal Foam Furniture, proudly made in Uganda, so buy Uganda and build Uganda. Visit our showrooms at Ginger Road, Chambogo Junction, Bukoto Chisasi Road, and on Victoria Mall, Entebbe, on the first floor.
UBC, inspiring Uganda.